Well, I'm in another parking lot, and this time I am about to walk in and get my first ever pelvic ultrasound. And guess what? So if you're new here, I am going through early menopause or for sure perimenopause, and I've had irregular periods for a couple of years and had other symptoms like hot flashes, feeling freezing cold, fatigue, um, hunger, a little bit of weight gain, poor sleep. Um, and then I didn't have a period from November 30th until just a couple days ago. So, surprise, I got a period. And it's been very heavy, like filling a Super Plus tampon every 2 hours. TMI, but isn't that what you're here for? So it's a little bit lower flow today, but I have to get a pelvic ultrasound. That was already in the works, but I have to do that while bleeding. So I have anxiety about that, but they say that it's fine. So I'll report back when I'm done and let you know how it went. And just like that, it's over. I survived. I didn't bleed all over the table, which is what I was worried about. And it was super quick. The woman who did the ultrasound for me was super nice. The lighting in the room was low. So they're obviously trying their best to make it a comfortable situation for their patients. And I'll have a follow-up visit with my nurse practitioner in a couple of weeks. Let's see, what's the date? Yeah, I have it in 2 weeks. So we will go over the results of the ultrasound and also talk about how I've been feeling since my last appointment. And you might be wondering, is the HRT what caused my period to happen? And maybe I'm actually wondering that myself. So that's on my list of things that I'll be asking at my follow-up appointment. I don't know if it means that my dosage needs to be adjusted or if it just means my body is happier now and has more of the hormones that it needs to ovulate. I don't know, because I had gone almost 4 months with no period, and that's without being on birth control or anything else. So yeah, we'll see. I'm definitely wondering about that. And I'm curious what this pelvic ultrasound shows. Something that I think is cool, if you've watched my earlier videos, you know, but I started down this perimenopause treatment journey with an appointment with Midi, MIDI, and they're an online platform. Maybe you've gotten ads for them before, but they are targeted at women's health care and midlife care. And I think that they've been very thorough. My nurse practitioner has been anyway. I mean, I got a lot of lab work done before she prescribed anything because I wasn't having a period and she wanted to make sure that there wasn't something else going on with my body, like a thyroid problem, because I didn't realize your thyroid controls your hormones and affects your cycle. So she wanted to check that. She checked my kidney function, liver function, cholesterol, my estrogen levels, my other hormone levels as well. Anemia, looked at my iron, B12. What else did I say? Cholesterol, glucose. Anyway, a lot of things. And then she went ahead and prescribed the low-dose estrogen patch and progesterone pill because due to my lab results and my health history, I didn't have a cancer history with myself or my immediate family. I don't have heart disease risks or blood clotting risks. And she felt comfortable to move forward with prescribing the patch and the progesterone pill, but wanted me to get a pelvic ultrasound done, just to cover all the bases and see if I have issues with my uterine lining, ovary function, all the things. So I just feel really comfortable, and I like that I'm getting these things checked, regardless what happens with my menopause or perimenopause path. I'm taking care of my health, so that feels really good. But yeah, that's today's parking lot convo. I'll see you in the next parking lot.